As technology continues to invade healthcare, it is imperative to have a process for securing electronic health information. In addition to complying with federal HIPAA and HITECH guidelines regarding patient information privacy, healthcare systems must be vigilant in managing and securing information and networks. The American Health Information Management Association stated that data quality and integrity requires consideration of privacy and security issues, including the protection of data against risks such as loss or unauthorized access, destruction, use, modification, or disclosures of data by parties not authorized to do so. There are many aspects of security that must be considered. The linking of computers together and to the outside creates the possibility of a breach of network security and exposes the information to unauthorized use. The three main areas of a secure network information includes confidentiality, availability, and integrity. Confidentiality means safeguarding all information by ensuring that access is limited to only those who are authorized. This includes protecting the physical screens while in use from those in close proximity. Blockchain is increasingly being used as a secure method of storing, authenticating, and protecting data. It is a decentralized, distributed, public digital ledger or database that records transactions across many linked computers. It cannot be altered or modified after a transaction has occurred. Establishing guidelines or policies to secure a network is important. Acceptable use defines the types of activities that are acceptable and not acceptable on the corporate computer network and the consequences for violations. Information integrity is essential as data is input and shared throughout the network. The information input into the system must be quality and accurate. Organizations often have clear policies clarifying how data are input, noting who can authorize a change to any data, and guidelines on tracking the how, when, and who is involved in any changed data. Security policies should also include guidelines regarding the authentication of employees. This includes user passwords, identification badges, and biometrics. This can include updating passwords periodically and using a two-factor authentication process. Threats to security are a very real and very serious problem. Surveys have found that human error is the most likely cause of security breaches. In 2021, 714 healthcare data breaches affected over 40 million individuals' records. 78.8 million patient records were stolen from Anthem Blue Cross, a health insurance plan provider in the United States. Investigative reports found that on the darknet, an individual's medical records could be worth $100 to $1,000, while a credit card is worth $1 or less. A data breach can cost millions. The first line of defense is strictly physical: a locked door, an operating system that locks down after 5 minutes of inactivity, and regular security training programs. Another way to improve security is to limit the authorization to write files to a device and remove USB ports on company desktops. The most common threats a corporate network faces from the outside world are hackers, malicious spyware, or a malicious insider. Spyware that steals user ID and passwords within a malicious code that is normally hidden in a seemingly innocent file download. Another huge threat to corporate security is social engineering, or the manipulation of a relationship based on one's position in an organization. Phishing is an attempt to steal information by manipulating the recipient of an email or phone call to provide passwords or other private information. A malicious insider is the #1 security threat to a corporate network. Software can be used to track and monitor employee activity. A full-time electronic auditor may also be utilized to monitor activity logs. There are a wide range of tools available to an organization to protect the network and information. These tools can be a software solution such as antivirus software or a hardware tool such as a proxy server. Email scanning software and antivirus software are also available. A firewall can be hardware, software, or a combination. This is set up to examine traffic to and from the network. Firewalls is the electronic security guards at the gate of the corporate network. Proxy servers prevent users from directly accessing the internet. Intrusion detection systems are hardware and software to monitor who is using the organizational network and what files that user has accessed. Any use of a secure network leaves a digital footprint that can be easily tracked by electronic auditing software. As remote work and telehealth have been increasingly utilized in healthcare, it is important to consider off-site use of portable devices. This includes laptops, tablets, home computing systems, smartphones, and portable data storage devices, and wearable healthcare devices. A virtual private network VPN that the user must log into in order to reach the network can help ensure that all data transmitted via this gateway are encrypted. HHS identifies potential risks and proposes risk management strategies including restricting remote access to computers owned or configured by your organization, disallowing administrator privileges on remote access computers, placing restrictions in the VPN and remote access policies, configuring the VPN to operate in a sandbox or virtual environment that isolates the session from other software running on the remote machine, and educating users about safe computing practices in remote locations. Technology changes so quickly that even the most diligent user will likely encounter a situation that could threaten the network. It is imperative that healthcare clinicians implement all tactics to ensure the safe operation of the system, such as physically logging out when walking away from the computer and employing caution when responding to emails that could be potential phishing scams. We all need to be alert and aware of the ever-evolving threats to our electronic health records for the care and safety of our patients.